দর্শক শুভেচ্ছা, স্বাগত সবাইকে আজকের চলতে চলতে অনুষ্ঠানে আপনাদের সঙ্গে থাকছে আমি মাহফুজ মিশা। আজকে আমাদের অতিথি icddr নির্বাহী পরিচালক জন ক্লেমেন্স। মোস্ট ওয়েলকাম ডক্টর জন ক্লেমেন্স
Thank
to
you.
our show. How are you?
Thanks for having me.
Yeah. John, you are here in Bangladesh for many years. Sometimes there is a gap, but you know Bangladesh very well, especially the health sector is very much well known to Dr. Clemens.
Sure.
Because during your early life, you were in Matlob, sometimes you have to live in the barge. So you see the health sector in 80s, and now you see the health sector of Bangladesh in 217 these years. My first question to you, how do you evaluate the Bangladesh public health situation right now, and if you compare it with the early times in 1980s, how the things are changed? What's the history behind this?
Well, things have changed dramatically here in Bangladesh since the 1980s. In the 1980s, Bangladesh had extremely high fertility rates, extremely high infant and child mortality rates. Diarrhea was the #1 killer of children. And really the icddr, from its very beginning in the 1960s, was created to address the health problems of the country with research. It's very interesting that since its inception, the icddr has conducted research to provide evidence, to provide guidance to the country to save lives. Since the very beginning. icddr was started in the 1960s as the Cholera Research Laboratory under the Southeast Asia Treaty Organization, addressing primarily cholera. But over the years, it has evolved substantially to address a wide array of health issues facing the people of Bangladesh. And yet another area of research from those early days was a demonstration of the impact of using female residents of villages as community health workers to help deliver family planning advice and contraceptives, as well as simple primary health care like ORS, vaccines, micronutrients. And that was scaled up beautifully with tremendous results.
Dr. Clemens, you have told about the goodwill of government. How do you evaluate the people? Because it's a Muslim-based country, and family planning is very much successful here. So people always take new things in their life. So how do you evaluate the roles of general people, especially the people from village who are not so literate? How do you evaluate their role?
Bangladesh is a country of innovation. And it's really a model country in so many ways for countries of the developing world. Health and family planning are but two examples. I think that the Bangladeshi people are unique in their willingness to dedicate themselves to innovate for the improvement of the entire society.
So obviously there are some stories behind this success story.
Sure.
And you must have to have faced some difficult situation during your early days when you want to introduce Orsaline, or when the Bangladesh government introduced vaccination program, when the family planning equipment was introduced first time. Have you had such kind of experience during your work here in Bangladesh?
Well, you know, it is human nature to be a little bit skeptical about change of any kind. Okay, but I think one of the keys to the success of Bangladesh was the wisdom of the leadership of the country at all levels, and the ability of the leadership to convince the population of the validity of these innovations. I think it's both a matter of the character of the people.
Talk about the Matlob Upazila. The history of icddr will not be complete. So you have been there in your early years also.
Sure.
And now still work is going on there. Can you please tell the early history of ICDDR research work in Bangladesh?
Sure. As I mentioned earlier, the icddr was founded actually as the Cholera Research Laboratory in the early 1960s. And it was really sponsored by the U.S. government, National Institutes of Health, USAID, and CDC. And in those early days, the focus was cholera. It was vaccines for cholera, treatment for cholera. And as I understand it, of course I was not there during those days, when the early founders of the CRL came, they wanted to find a place in Bangladesh that was severely affected by cholera, where these studies could be done meaningfully and appropriately. And they scouted around, and Matlab was identified as a focus of cholera year after year in Bangladesh. And so a field station was set up in Matlab where the necessary studies could be done. I mean, it was in Matlab that the value of oral rehydration solution was first demonstrated. It was first in patients and then in homes, teaching mothers how to make it and give it to their kids by themselves. It was in Matlab where a number of early cholera vaccine trials were done. It was in Matlab where this unique strategy to family planning of mobilizing female community health workers as the principal agents, it was devised in Matlab. So many things happen in Matlab.
Still you have a lot of data of that Upazila who is could be helpful for any kind of research regarding health, public health and policy. We have a lot of questions to you. I would like to take a short break and want to break you again. দর্শক ছোট্ট একটা বিরতি নিচ্ছি, ফিরছি একটু পর, আমাদের সঙ্গে থাকছেন নিশ্চয়ই। দর্শক স্বাগত আরেকবার। আমরা কথা বলছিলাম আইসিডিডিআরবির নির্বাহী পরিচালকের সঙ্গে। Dr. Clemens, generally people know in your organization ICDDRB as cholera hospital. And thinking of mass police, it's an specialized hospital. If I or you or anybody attacked in diarrhea, he should come, he or she should come here. But ICDDRB is basically a hospital, or what's the basic work of this organization? Can you please tell us briefly?
So the hospital is one of three major activities of the ICDRB. And the hospital is very important. We treat over 200,000 patients free of charge every year, and we estimate that we probably save the lives of about 90,000 people every year, free of charge. But much of our work actually is in research, generating new knowledge to guide public health for public health impact, and in training. We do a lot of training of pre-doctoral students, doctoral students, clinicians, nurses. It's very wide-ranging, and but in research, whereas in our early days we focused on cholera and diarrhea, expanding to population studies and nutrition. We do research on reducing maternal and neonatal mortality. We do research on control of emerging infections like avian influenza, Nipah virus. We do research on control of enteric and respiratory infections. We do research on improving maternal and childhood nutrition, on improving access to care and achieving universal health coverage, on adapting to climate change.
Every year during when the weather become very hot, the patient of diarrhea is increasing, and you people and your doctors become very busy to serve them.
Sure.
We have seen it. My simple question is that why diarrhea is it decreasing or increasing every year?
So Diarrheal deaths have plummeted to a very low level. But that said, there's still a lot of diarrheal disease that doesn't kill. And that's a major challenge which we are addressing with our research on controlling diarrhea through vaccines, improved water and sanitation, and other measures. So the incidence of diarrhea remains rather high, but the mortality has plummeted very low.
What are the causes behind this, especially in the Dhaka city? Why so many people have to suffer on diarrhea every year?
Diarrheal diseases are transmitted fecal orally. And when human waste products contaminate either food or water, that's when diarrhea occurs. And so, undoubtedly, one of the reasons is the tremendous increase in the population and crowding here in Dhaka City. There's a tremendous amount of migration into the city, as well as challenges, for example, in renovating, the piping system of water to faucets where people collect their water for drinking. But that being said, I know that Dhaka City is very, very actively addressing these problems. The leaders are very cognizant and active and good-willed, and I think that we'll see good things to come. In the meantime, vaccines are a important thing for Bangladesh. Bangladesh will be introducing rotavirus vaccine for children, the major cause of pediatric diarrhea. And we are very much involved, working hand in hand with Incepta Pharmaceuticals to make a inexpensive, effective oral cholera vaccine available countrywide.
Dr. Clemens, again we have to take a break, short break. দর্শক আবারও ছোট্ট একটা বিরতি, ফিরছে একটু পর, আমাদের সঙ্গে থাকবেন নিশ্চয়ই। দর্শক বিরতির পর স্বাগত আরেকবার। আমরা কথা বলছিলাম আইসিডিআরবির নির্বাহী পরিচালকের সঙ্গে। স্যার, we are about to in the last stage of our interview. I just want to know, how do you evaluate the Bangladesh government role on health sector?
I think the government is outstanding in its efforts to improve health.
In Millennium Development Goal, Bangladesh performance was very good, and the whole world know it. Now SDG is in front of the government, Sustainable Development Goal. If Bangladesh government would like to be successful in SDG, especially in the health sector, what's your suggestion? What should we do?
The next challenge facing the government and the country is a health systems challenge of making high quality, affordable health care accessible to everybody. And as well, Bangladesh is now having to tackle new diseases that were not problems in the past: diabetes, stroke, heart attack, cancer. And those diseases can only be tackled with strong health systems. So that, I think, is really the key challenge. And so I think, once again, we will be working in sync with the government for the benefit of the people.
Health as well as the treatment is the fundamental right of every human being.
Right.
How do you evaluate the health system, healthcare system, especially in the government-led medical hospitals and other clinics?
I think the system is a good system, but it's, of course, like health systems everywhere, even in my country, the United States, it's in need of attention and improvement. The enormous strides I've seen in the quality of the of the hospitals and the healthcare system have occurred certainly since I was here in the 1980s. It's day and night. And so I think that we should be very optimistic.
How do you evaluate the role of Bangladeshi doctors?
The doctors, of course, my major contact with Bangladeshi doctors is in our own hospital. And I think that they are very well trained and very committed to patients. That's one of the things that has always impressed me about the doctors in our hospital.
Finance is a big factor regarding healthcare system, developing
Sure.
healthcare system. And in every financial year, government increasing its budget on health sector.
Sure.
But still, do you think is it enough for a big country?
In terms of calibrating the budget to specific goals. And so it's simply saying it's enough or not enough probably is a very superficial way of addressing it. I think the key thing is, as you say, the government is increasing the budget. The government is committed to real outcomes. I mean, that's why Bangladesh was one of only 6 countries in the world to achieve MDG 4 and MDG 5. The government is focused on outcomes, and I think that the way forward is going to be very, very positive.
But one very negative thing that our policymakers, like the ministers, government officials, high officials, they are not taking their treatment, not even go to the hospital for their regular health checkup. They went abroad. So sometimes it creates misunderstanding between the general people that they are not taking their treatment here. So that's not good. It happened everywhere in the country, or it's a new phenomenon in Bangladesh? What's your evaluation?
I think very good health care is available here in Bangladesh and can be availed by people from all strata of society.
So you are very hopeful regarding Bangladesh healthcare system.
I am. There's a lot of work to be done, but there's a lot of commitment to do the work. And that's always been the story of Bangladesh. Commitment, work, success.
Thank you. Thank you for your valuable time.
Thank you.
দর্শক শেষ করছি, আর দেখা হবে পরবর্তী পর্বে নতুন কোনো অতিথির সঙ্গে। সে পর্যন্ত ভালো থাকবেন সবাই।